The patellofemoral joint is now prepped and draped, and I am inserting my cannula into the suprapatellar pouch. In this situation, we're coming in from a supromedial portal. I'll often use the medial side in case there's some lateral patellar tilt, which would make it more difficult to insert a trocar or a needle into the patellofemoral joint. Ideally, the VisionScope trocar should be placed just above the trochlear groove cartilage and below the patellar cartilage so as not to be embedded under the synovium, which would make visualization difficult. Once the scope is placed into the patellofemoral joint between the articular cartilage of the patella and the trochlea, I will place some saline to help displace any extra synovial fluid or blood that may have resulted from a slightly traumatic puncture. It will also help distend the patella from the trochlea just enough to allow the VisionScope to be placed completely over the trochlea, more distally in the groove. In the situation you're seeing now, as I'm looking at all aspects of the patellofemoral joint, I'm able to visualize the medial facet, the lateral facet, and the central aspect of the patella. I can also do a dynamic test of patellofemoral tracking by placing the knee through a range of motion from 0 to 90 degrees during the procedure. I'm again adding a second syringe of sterile saline just to keep the view as clear as possible. You can see that I'm blowing away small droplets of blood or synovium that would help cloud any potential field of view. Next, you can see the marked degeneration of the patella and the deep grade 3 or functional grade 4 defect of the central trochlea. You can see the surrounding unstable chondral flaps on the trochlea itself. You can see right here in the central aspect, again, looks like a functional grade 4 defect with unstable loose chondral flaps surrounding it. I'm now aspirating some of the fluid. I like to try to remove as much fluid as possible prior to the end of the procedure.